I think we can probably just get started. Maybe, Anna, if we could start with you and maybe just hear a little bit about your story, what you maybe went to school for, your degrees, and then kind of how you started out into this career. That would be great.
Sure. So, for everyone on the call, my story is not your typical, I went to college for this specifically. I knew what I wanted to be when I grew up and just did it. It took me longer than the average bear to kind of find out what part of healthcare I wanted to serve in. So I actually went to UTD for my undergrad in child development, which I found wasn't my cup of tea in the business world. So I switched over to working in a hospital, and I was in hospital operations for 8 years and started out in patient access as one of those registration people that you give your insurance to, and learned so much about, the front end processes and how those affect the back end processes. So I worked in operations, which is an industry term for the front end where care is given. And so I worked there for 8 years, and then I moved over to a revenue cycle management company, and I kind of fell in love with process improvement throughout my time, both in the hospital as well as in the revenue cycle company that I currently work for. So I specialized a bit in process improvement. I then decided to go back to UTD's Executive School of Management and Healthcare program. So I graduated from there in 2019. And from that experience, it was just eye-opening to see all of the different career paths from the different people who were in that program as well. So I found it extremely helpful for my own journey to just see where everyone else came from, where they are on their journeys, how they decided to make those transitions. So currently, I am an analytics and business intelligence director, and my tiny slice of the puzzle is performance and analytics. And the reason I love it so much is because when people mention the back end of healthcare, we're really talking about everything from the point of service to when a provider is paid for having provided those services. So I fell in love with the analytical space of that and being able to see how a process works, see what opportunities there might be, see how we might be able to transform different processes and help ultimately providers and clients more successfully gain that revenue so that they can continue providing services to patients. So that's a little bit about me and my background. Did you guys have?
I have lots of questions. I don't know if anybody has. I'll hold off till maybe Professor Carnuta gives his intro. But students, do you have any questions for Anna at this point? We have lots of time. All right, thank you, Anna. So Professor Carnuta, can you talk to us about, what you studied in school, what your majors were, and kind of your path after you graduated, kind of how you got into healthcare?
Yeah, some of you probably heard my story before because I've been around, but it's interesting that Anna and I ended up in the same place at different times. We didn't know each other. I left Conifer in 2018 to come here full time and be a professor at UTD. But I went to Penn State, and I was an accounting graduate, so a business graduate in accounting. And I went to work for the big 8 accounting firms. There were 8 of them back then. Price Waterhouse when I got out of college, and I was an auditor for a while, and I got a master's in taxation, so I was a tax professional, and I did that because I wanted to do something that was very intellectually driven and specific, like law, or in this case, tax law. And so I became a tax manager at Price Waterhouse. Then I got recruited to Perot Systems, which is a big IT company that we eventually got acquired by Dell about 20 years after I joined. But when I was at Pro Systems, I got a lot of experience and ended up being CFO of their healthcare division, which is how I got into healthcare. And then after leaving Dell, I actually got recruited from Dell to go and be CFO of Conifer Health Solutions. So, and I was CFO of Conifer for 7 years before coming here. So that's my background. I'll comment on a couple of things. I think Anna's much more, her story is much more relevant for you guys as you think about your careers and career week, and specifically what we're talking about here, which is the revenue cycle. So, Anna talked about things that are second nature to professionals like her, like me, the front end, the back end, and so what she's talking about there is the revenue cycle space. It touches everything from when the patient walks into the hospital, even before the patient walks in the hospital, to the time that they leave. Revenue cycle management is involved, not in the clinical side of giving care, but they actually do meet the patient. So when she's talking about the front end, she's talking about meeting the patient for the first time, getting patient to the right place in the hospital, and then the care that's given. So that's the front end. That's what hospitals are known to do, right? They give care to patients. So when you talk about front end, that's the front end. But a lot goes on in what we call the back end. And the back end is, okay, someone's got to track that patient all the way through the hospital, keep track of what's being done to that patient so we can capture every little thing that happens, because every little thing that happens is a procedure that can be billed for. So the back end is the business side. The front end is the clinical side, and the back end is the business side. And most of you guys are going to be working in the back end someplace. So the back end, again, is capturing what's being done to the patient and then turning that into a claim or an invoice that then gets coded and sent to the payer for payment. And that is just such a gigantic and confusing process that people like Anna get hired to watch over the process and analyze the process and go and test the process and try to break the process and find out where things aren't as good as they should be, because the hospital wants to make sure that that process, that back end process, takes as few resources and as few dollars in cost as possible. And that's what business is all about. It's making the processes efficient so that the company runs as smoothly as it can. And in our case, it's a hospital or a doctor's office. So the revenue cycle management space, it starts with pre-registration. Okay, to start before the patient even comes into the hospital's door, somebody has to schedule that patient. So a doctor will call the hospital and schedule a patient, or have the patient call the hospital to schedule that patient for when is the procedure going to get done. Well, that's a revenue cycle management person that they're talking to, a pre-reg person, pre-registration, pre-reg. Getting that pre-registration person takes that patient's information, finds out what's wrong with them, tells them what's going to happen, tells them when to be there, tells them when to go when they're there, gets their insurance information, gets their demographic information, their social security number, all that stuff, all the stuff that the hospital is going to need on the back end to bill the patient. That's pre-registration. So that's talking to somebody a patient talking to somebody on the phone. Then when the patient walks in the door of the hospital, that's registration. Okay, and that's what Anna did when she first got into revenue cycle. She was a patient access professional, and they sit down with the patient and understand what the patient's insurance is and their demographic information. And they double check the pre-registration information to make sure it's all right, and load it into the computer system of the hospital, because that's all the information that's needed for a successful invoice to go out the door later on when the procedure's done. Then the patient access person instructs the patient what to do next, and that patient ends up in a procedure room and the procedure gets done. Well, that's the front end. Okay? That's the clinical work that the hospital does to the patient. But somebody's got to be keeping track of what's being done to that patient, and that's revenue cycle management. Okay, the doctors may be taking notes or dictating what they're doing to the patient, but someone's then got to take that information, turn it into billable services here's all the stuff the doctor did, here's all the drugs we gave the patient. All that stuff can be billed for by the hospital. So that detail needs to be taken down in language, in writing, and then converted into codes. And that's called coding. And that's part of the revenue cycle management function, which is coding those procedures that have been done and turning them into codes that the payers, the commercial payers like Aetna and Blue Cross and Blue Shield and those guys, and the government, so Medicare and Medicaid, codes that everyone understands. So it's a second language that hospital people need to speak, is these codes. And there are specialists that specialize in coding and turning procedures into codes that then get put onto the claim, if you will. And finally, the revenue cycle management function sends that invoice to the payer and then tracks it to make sure it gets paid. So it's a major function within a hospital, within our industry. And every little stop along the way that I explained there is a job opportunity. And Anna's just a perfect example of someone who started on the very front end, patient access. That's what it's called, a patient access professional. We all know what access means. It's having access to care. Well, the patient access folks are the people who give that access to the patient. They can contact these people and get admitted to the hospital. But then she took that and she learned what she did there. And I'm putting words in your mouth, Anna. We talked briefly, but she learned what she did there. And then she saw the other parts of the revenue cycle and say, hey, I can do those parts too. And by the way, those people make more money than I am. So I'm going to go get a master's degree and jump into, the more process side of revenue cycle management and make my living this way. So, I know I wanted to talk kind of fast there to get all that out of the way, but you can tell all of the opportunities that are available to healthcare specialists in the revenue cycle side.
Well, and that's exactly, I think, what the purpose of today is. So also, there are students invited who have no idea about revenue cycle or healthcare management if they are in another major. So I think kind of covering all of those basics and what that whole life cycle looks like helps give a clear idea of what are then the career possibilities within that cycle. So you mentioned patient access professional, and I stuck that in the chat. Are there other, just if you guys can either just think of, either one of you, some other job titles that we can just stick in here that students can maybe go to, let's say if it's a Conifer Health Solutions website, or maybe one of the big hospital healthcare systems, but what are some job titles as an entry level position should students start kind of considering? And maybe also touch on, is it something they can do while they're in college, or are these things that they should do after they graduate?
So
And
I'll
start
jump
taking
in and give you guys a few different titles. So I have hired people straight from UTD to be on my team while at Conifer. And as long as, so while I had operational knowledge and background when I came to Conifer, you can also learn it as you go. And so there are some specific titles like business analyst, which seems very vague. But if you search for a business analyst title within any of the big revenue cycle companies, there's several of them out there. But that is the title that is pretty entry level, but still provides compensation that stays pretty in sync with your education. So, patient access reps, most of them don't have degrees, and they're happy just to sort of stay there. Not that there's anything wrong with that at all, but if you're looking to get into more of the process side of it and really reviewing the analytical perspective of the revenue cycle, I would say business analyst is a good title to search. I would also search for anything with business analytics or business intelligence. There are also client delivery type roles in revenue cycle. So in revenue cycle, companies like Conifer are hired by big hospitals to handle everything from coding to collecting the payment from the insurance carriers. And so because of that, there are client delivery liaisons, and their job is to really be the go-between between the client and the business side of it. And so you can also do that kind of as an entry-level position as well. So there's also a huge push for process improvement within the healthcare revenue cycle. Really analyzing what is done current day and then saying, how can we optimize that? So I know a lot of good companies are looking for people who can look at what is done right now, think critically about it, and think, okay, do we have opportunities? Do we have wasted time in this process? And of course, oh, I apologize.
If I were at home, my dogs would be doing the same thing with Amazon deliveries every day. So we get it.
So anyways, there's lots of different healthcare titles which are entry level. And as long as you have a love for learning, you don't have to know everything about revenue cycle when you go into it. And everyone who is in revenue cycle who I've ever met is more than happy to knowledge share with you and just bring you up to speed with, here's our tiny piece of the puzzle and here's what's relevant for our process, and just sort of take you forward.
Perfect.
So I'll jump in while the dogs are attacking whoever they're attacking. I was sure that was going to be me. I just put my dogs out because I'm expecting chaos any second here. But I'll just add to that when, those positions that Anna was talking about, business analyst, business intelligence, client delivery, those all require, and this is something I've been pushing to my classes, analytical skills. Okay, it's not, you're not going to jump into a big job in the revenue cycle space when you graduate, or really any other space out there in the business world, with things like, the cost of healthcare is too high and we got to figure out ways to bring that cost down and to increase patient access and the triple aim and all that stuff. I mean, that's theoretical, educational, stuff that we teach as a basis. You have to sort of understand that to understand how the industry works. But when you're out there searching for a job, you've got to be much more focused on, what you can bring to the employer. And so these titles, they say it: business analyst, business intelligence. They're looking for graduates who can take an Excel spreadsheet full of numbers and analyze it, and come up with okay, here's what this tells us. So they're looking for Excel skills, and that is really probably the main skill that you have to have when you're starting out, so that you can be given, some work to do. It's going to be given to you in a file in Excel, and then your manager is going to help tell you what to do, and you're going to be able to learn on the job. But you got to have those base skills going into it to be able to analyze. A business analyst analyzes. A business intelligence person takes a look at data and derives information from that data. So, like I said, it takes an analytical bent to be able to get in there and really start adding value.
Well, we had a session yesterday, maybe some of you were on the call, and it was actually about healthcare IT and analytics, but so many of these skill sets and experiences cross over. And so one of the speakers yesterday, I think she's she graduated with her MBA a few years ago. So I think she's like 27, 28 years old. And so she's a senior analyst at UT Southwestern. And part of her role is, as I talked to her beforehand, and she takes, whatever is this data set, makes sense of it. And then she's making recommendations to the executive team. So she's like, just little old me is making, impacting some really big decisions at a UT Southwestern, for example. So I definitely hear it in every session so far, this need for critical thinking and kind of an analytical mind, I guess, in no matter what type of work you're getting into. So it's a good theme, I think, for us to keep up with.
Yeah, and some other job opportunities out there in the revenue cycle space would be everything from a call center representative. Okay, call center representative is kind of what it sounds like. I mean, it's a floor in an office building full of cubicles where the call center representatives sit, and they've got headphones on, and there's an automatic dialing system that dials patients that owe money to the hospital, and the call center rep has a big dashboard in front of them, and whoever that patient is, all their information pops up as soon as the number's dialed, and it pops up that says, okay, here's how much that person owes, here's how much they've owed it for, here's the calls that have taken place in the past with this person to try to collect the money, and then they're automatically connected to the telephone of that person, who may or may not answer. But if they answer, they talk to them for a while, and as soon as the call center rep hangs up with that person, they document what they've done, what they've said to that person, and what happened in the call, and then the dialing system automatically dials them another call. So that's an entry-level position at a revenue cycle management company, that gets on the very, very front end of that process, which is calling patients to find out where the payment is and what we can do to help get it paid. And it's not something that you're going to probably want to do forever, but it's a stepping stone. You get in there as a call center representative, you learn how all that works, and then you can become a call center rep manager. So instead of taking calls, you're managing 15 other people who are taking calls during the day, and you're helping them. And then you learn the call center part of the business, the revenue cycle business, which is collecting the cash, which is one part of the business. Then you can move to another part of the business, maybe the part that Anna's in now, and the more parts of the business you start to learn, the higher a promotion you're going to get, as you go along. So you got to try to learn all different parts of the business. So the call center piece is kind of ground floor revenue cycle management. And then there's coding, to be a coder, which is a specialist. So that's something that you'd have to actually, take special classes to become a coder. It's something you could start in a coding department of a hospital, of an RCM function, as a non-coder, to kind of a coder in training. And then, as you move through the process, you become a full coder as you start to learn how that works. And then another area would be compliance. So making sure that those invoices or the claims that go out the door to the payers and the codes on those claims are accurate. It's very important that the codes are accurate, because it's very easy to miscode a claim and charge the payer too much, or put a code on that doesn't get the hospital enough money. So the hospital did something more than what the code says. Well, then the hospital's losing money in that case. So, and if enough codes are wrong, then you can get in real trouble with the payer, especially if it's the government, Medicare and Medicaid. If a hospital is overcharging Medicare and Medicaid, and it's found that's being done on purpose, then people go to jail. So revenue cycle management functions of big hospitals have compliance departments, and those compliance people understand what happens in the coding and invoicing part of the process, and they basically audit what's going on. They take a look at some of the invoices and the claims and make sure that the claim matches what was actually done to the patient. And then they look for issues where the claim wasn't right, and they keep track of them. Well, how do they keep track of them? Well, on Excel or on some other system software package that the company has. So the analytics people keep track of percentages of wrong coding, that type of thing. By coder, so they keep track of, basically they grade the coders to make sure that the coding people know what they're doing. So compliance is another area that our degree, healthcare management, would fit into pretty nicely.
So if we were to kind of progress from entry level, so this is like maybe virtually no work experience, things maybe like a part-time position a student could get, maybe some of these while they're in a degree. So what are we talking with a degree and maybe a little bit of experience? Is there kind of a progression, or even maybe let's say 3 years out from school, what type of career positions or just types of job functions can students expect to be maybe be eligible for or to plan for, where it's not just basic entry level, but maybe like that next step?
So I would say that after 3 years, so it's all about learning the different pieces of the puzzle and learning how the different pieces interact with each other is also very, very important. So as you get into your role, wherever you start, if you take that and then just turn it up a notch and continue to learn and say, here's an opportunity that I see, to make something better, or, to help increase my knowledge of a specific process. There are some additional certifications that you can get that are nationally recognized. One is called a CRCR, but there are several different national recognitions that you can study for and take an exam and become certified so that you know how the revenue cycle works. So I would definitely say take some time, learn your piece of the puzzle, but also learn, okay, if I'm a registration rep, how does what I do affect the denials team down the road? Or how does what I do affect, our aging inventory? So when we talk about aging inventory, we're talking about accounts which have spent greater than 90 days with us trying to obtain a payment from the insurance company. And you'll learn lots of insurance companies also have revenue cycle positions, but there are 1,001 different reasons why they might not want to pay for the services. So really digging in to, how can I take my position one step above? And, if you start moving to working projects with certain groups to increase cash flow, I would say any natural progression would be to just continuously learn. Even if that's not my job or that's not my area, that doesn't exist in healthcare. It all works together. It's all one puzzle. So if you just continually start learning all the different pieces, you will be able to better present yourself as a more knowledgeable person in a variety of fields. And when you become knowledge in a variety of those subspecialties, I would say that is sort of when you become qualified to lead in a certain area or lead projects in a certain area. So I would think, you could either become a supervisor or a team leader or a manager, whatever you want to call it. But I would definitely advise you become very curious about all the different pieces and how they work together, because I am still learning new things every day, and I've done this for 12 years. So I think that my best advice would be, don't just put it on a timeline, because you could progress, up 3 levels in 6 or 12 months, like I did at Conifer. Or you could spend, 2 years somewhere and never really progress. So it just depends on the knowledge that you continue to obtain and the new ways you find to apply it out to the other areas.
That's so smart.
Yeah,
When the program, we meet with students and they often want to know, and everybody does, everyone's kind of I think human nature. I want it now. I want to know what I have. I don't want to wait for it, instant gratification. And so I think this is a theme that we've heard throughout. And, we hear with students a lot as they say, I want to be a director when I graduate from the program, or whatever the example is. And kind of knowing you really have to be that expert in an area. And I put it in the chat, that then qualifies you to lead that area. And so if you don't have expertise in it, you can't really lead in it yet, but it is going to come. It's just a matter of time. So that's so smart. Thank you for sharing that.
Yeah, and you'll be surprised how much as students, how much you don't know when you get out there, into your first job, but also how much you'll learn in the first 2 or 3 years. I mean, it's incredible amounts. And so when you start someplace, we'll take that business analyst position. There's usually, like, say, 3 levels of business analysts. So there's BA1, which is a beginner right out of college, right? Then you can get promoted in a year or two to business analyst 2, and you get a nice raise and more responsibility. Then business analyst 3, and then after that, you become a supervisor. Okay, so then you're supervising business analysts. So until you become a supervisor, you're what we call in the business world an individual performer. Okay, you're doing a task. You don't have anybody that's reporting to you. You don't have any employees working for you. You're just part of a team. But then you become a supervisor and you've got a team to manage. Then you've got to know, what a balance sheet and income statement and keeping track of your costs. You're not going to make it to supervisor unless you can prove that you know how to do that stuff. And then after supervisor, you become a manager, and after a manager, a director. And so there's a progression that it takes years, to get up to the higher levels, because you just got so much to learn. The people who graduated 3 years ago are 3 years ahead of you. They've been out there and they've been learning for 3 years how business works. Don't jump in there and think you're going to be able to, to hurdle them. But as I always say, try to shoot as soon as you can. Try to shoot for doing things that the level above you is doing. See what they're doing and try to grab some of that stuff and do a good job at it, because that's what gets you noticed for getting promoted earlier than a normal track. But that's typically how it works. Is there's just different levels of job descriptions, and you work your way through those levels to get up to supervisor or manager.
And I would absolutely agree with that. Your point of grabbing some of what the people above you are doing and start doing that, so that your leaders recognize, oh, they can do this level of work. Okay, let's go ahead and, recognize that opportunity there.
That's so smart. Anybody on the call have a question at this point before we continue? Okay, so here's one. How can we get connected with Conifer or any other revenue cycle organizations? Maybe what's the first step?
So you have to basically Google the company, but their website has, and every website I've been to has a career section, and you can just sort of browse through what types of things they have to offer. Conifer is a great one. Ensemble Health Partners is a great one. So really just finding companies, and you can even Google the revenue cycle, big companies within the US. There's a report called the KLAS report, KLAS, and it ranks the different revenue cycle companies. And so you can see, what is one's strengths, what is their weakness, who do you want to work for? And then if you go to that company's website, they'll all have a career section. You'll be able to browse through. And then what I would recommend doing from there, once you've decided, I would love to work for any of these 3 companies, try to network. Find someone who works there on LinkedIn and say, hey, I see you're an alum at Conifer. I'm at UTD as well. And, could you help me get plugged in with HR? Do you know of any opportunities? I have never, ever turned someone away who wants to help get plugged in. I know it's kind of hard when you're fresh out of school and your networking skills maybe not be the best. You may not know a ton of people, but just find someone through LinkedIn and connect with them and say, hey, I've read a lot about your organization. I would love to, maybe join the company, and could you help me get plugged in? So I wouldn't hesitate to reach out.
Yes, and if you're going to do that, be prepared. Do your homework. Learn the company, learn the business, learn what they're looking for as far as positions to hire. I said this yesterday, if you were on the intro meeting that we had here, is that you've got to do your homework and go in knowing that company better than the person who's talking to you knows the company when you're looking for a job. I would also look for job fairs. A lot of companies, I know in Conifer, when I was there, we would have a job fair at least once a year, where the company would basically open itself up and say, if you're looking for a job and revenue cycle, come visit us on this day, and you get to go see the company. Because especially now, a lot of employers are looking for candidates to join the company. There's a good job market going on right now. So revenue cycle companies in those, especially the lower level, the entry type positions like the call center positions and the business analysts, they're looking for people, and it's hard to find them. So they have these job fairs. So that's a way to to get in there and actually go visit the company. And then I would also recommend for the revenue cycle space, if you've got interest in this area, to join HFMA. Which is the Healthcare Financial Management Association. Those are the revenue cycle folks within our industry. Everybody, just one F.
One F.
Quincy. Yeah,
Okay.
HFMA.
HFMA.
Healthcare Financial Management Association. I mean, that's the place that all revenue cycle people join, is HFMA. And I'm pretty sure they have a student rate that you can join as a student. But you get that, and then you start to get their newsletter and read it, and you can start to connect with people in there, and then you've got connections, throughout the country, at that point.
So in addition, we've talked a little bit about maybe kind of some basic skill sets and a little bit about the classes, but so while students are in the programs and are kind of in this preparation phase, what recommendations do you have? What should they be doing with their time? Actually, there's a couple parts of this question. Are there classes you recommend that they should take? And then in addition to the classes, what experiences should they try to get for themselves before they graduate?
Yeah, so I'll start. The classes that you're getting as the core classes in healthcare management are the ones that you need to start you out. And I would say that the biggest opportunity lost is for students that don't take advantage of the core curriculum that's given to them. They'll get into a particular class, whether it's econ or finance or accounting, and they're like, I hate this stuff. Oh, that's business. That is what is out there in the business world, not the triple aim, not that stuff. It's the analytical business stuff. So take advantage of what's in front of you now. You don't need to go out there and do accounting for dummies after you graduate. You've had 3 or 4 accounting courses. Make sure you take advantage of them when you're sitting there in the class, and you're there anyway. Learn while you're there. That's what you're going to need when you're out there. Because I don't know that there's a whole lot more that you would need to do class-wise once you've got your degree. I said yesterday, and I'll say it again, that you should now, especially as you become an upperclassman in undergraduate, is to get the Wall Street Journal, read it every day. You'd be surprised, after reading it for 2 weeks, you will be so up on what's going on out in the business world. It'll be incredible. You won't believe how much that's going on. But get that and read it, and join some sort of thing like HFMA or ACHE if you're not digging the revenue cycle piece and you're more of an general healthcare, then join ACHE and get their newsletter and start reading that. But you got to start um, getting out of you're transitioning from student to the business world. So make that transition. Start making it. You don't in the business world. In a business world, if work starts, if the business opens at 8 a.m., you don't roll in at 8:15 looking like you just rolled out of bed. All right, that's a good way to get yourself fired, right? You roll in there with your A game at 7:50. That's how it works out there. So you've got to, and I know that's not, as you're a student, especially a freshman, coming in from high school, you've got to get accustomed to that sort of discipline. But you got to start training yourself now so that when you get out there, you're ready, and it's just part of how you work. So start transitioning from student to professional.
Absolutely. And I'll just add on to what was previously said. So don't ever think that something doesn't apply to you. So I think in my undergrad, I took statistics for non-science majors and thought, I'm never going to need to know any of how finance works. And that is wrong. So go ahead and, I would recommend definitely taking advantage of those core courses if they're offered, but also don't ever think that it's not going to apply to you in the future just because it may not right now. So even in my analytics work, finance absolutely applies to me every single day. So I would definitely take advantage of keeping that knowledge handy because you are going to need it. Another thing that I'll recommend are some different healthcare business podcasts. So I'm a podcast girl. I work from home. I listen to my podcasts while I do my work. And there are a ton of very interesting, how healthcare is working in the business world podcasts that I just listen to throughout the day. But it takes you from being just someone who works in healthcare to someone who is absorbing how the healthcare business world is developing, both in our country and others. It's important to know the grand picture of how everything is working, because then you'll know how that affects you in your role and be able to make more informed decisions. So I would definitely recommend just wherever you get your podcasts. I know that Bob Kaiser's group does some healthcare management podcasts as well. So they've got some good ones with guest speakers on, but really just listen to what other healthcare leaders are saying. Absorb that information and be that transformative person that is going from I go to class and I learn X, Y, and Z from I am interested in healthcare, so be interested in healthcare. There's also a lot of internship project type opportunities. I know at least within hospitals, I know they're always looking to make different improvements. And so what I look for when I interview undergrads or recent grads is, did this person show initiative? Like, what actual business experience do they have, even if this is going to be their first paid job? What did they do their last year of college when you have no classes on Fridays and, it may not be the most difficult semester. So did you leverage that? Did you find an opportunity to sort of put your foot in the door and learn about how healthcare works, whether you're learning about how it works on the front end or back end or somewhere in between? Did you take that opportunity to look for an internship and try and learn how healthcare works within a space? Because someone who has taken that initiative, I'll know that they have that same initiative in them to then take it to our projects and translate over. So people are looking for people who take initiative.
Taking notes here.
Yeah, and Anna's a great example of, Anna's undergraduate degree isn't even business, right?
No.
So, so she was behind the eight ball to begin with, right? She wanted to get into business, so she got a master's. But imagine going into getting your master's degree and taken some of those courses, a master's in business without having any business background. And I see that all the time too in the master's program. I'm teaching the finance part of the master's program in healthcare management, leadership and management, and more than half of my students every semester haven't had any accounting or any finance background.
Mm-hmm.
So they're behind the 8 ball to begin with as far as getting back up to speed, but they do it, because they know they have to. That's how the business world speaks in those kind of languages. And you can do it. I mean, you're looking at her, right? That's the poster child. You can start, not even knowing that stuff, not even knowing that you don't like it. and then getting it and realizing that, I need to get this. I need to understand what's going on here. And then you pick it up as you go. It's not it sounds daunting to you probably now, because you're not out there in the business world, but once you get out there, you'll find out, that you're going to be competing against folks at your level. So you all basically don't know much about what's going on. And so you just got to be the one who's one nose ahead of everybody else, as far, and to do that are some of the things that Anna was talking about. Get yourself, like she said, this is your chosen vocation. So get into it. It's hard to put that skateboard away. I mean, look behind me. I mean, I still have a 20-year-old in me that I just can't get rid of. but you just, you can keep that and still, I call it, my wife sees me get out of my shorts and my t-shirt and put on my clothes to go and teach at the university. And I tell her, I said, yeah, I got to go put on my professor costume now, which, so, it's just the business world is a different world than the one you're used to living in.
Mm.
So when in Rome, do what the Romans do.
Mm-hmm.
Well, so what, we've, kind of touched on, I think, industry expertise. And I mean, I put so much of your great advice into the chat here. But if we're just talking kind of some of the basics, so as professionals, what advice do you all have, about resumes, interview tips, kind of just some basics? We have a career management center here, so students will often utilize, some of the resources there. But kind of from your vantage point in healthcare, what are things that students should focus on? Character, strengths and weaknesses, resume builders, kind of some of that, basic career stuff, I guess. Is there any kind of last advice you would give students if they were to go home tonight or this weekend with an action plan? So reading through what you've described, what advice should students leave here to go home and do? Homework, I guess.
So I'll share some of my resources. I know that Zeddy.com is an incredibly smart resume building website. So all of the people that I know use Zeddy in order to format their resume. If I see someone submit to me just a Word document with bullet points, I'm probably not going to look at it. So I need someone with current relevant experience that is in a format that is easy to read. So I would definitely recommend that. And Andrew Lasavita is someone who is actually a career coach, but he's got a ton of free resources available for, how to interview, how to negotiate salaries. And, he's a really good resource that I have used personally as well. And so I would also recommend, use your resources there at UTD. So, do what you think looks like a really great resume and then pass it off to some people and say, hey, can we do like a mock interview? Tell me what you think about this resume. Would you hire me? Or, I would go through some of those practice sessions because it needs to be second nature to you to give these answers. It needs to not sound rehearsed or like you're trying to ask questions off of a list. So I would definitely recommend practice. And then my other piece of advice would really be to always center yourself on, why am I doing this? Why am I getting into healthcare? why am I pursuing this opportunity? Why does it matter to me? Because you need to know that to keep yourself centered. I recently, or tomorrow actually, am making a career move from one company to another, but you need to know why, and you need to know what's important to you. So really having that down pat will help all of your other answers come a lot more easily. That's definitely something I would recommend. And then practicing with people and sending a few examples out. But that would be my tidbit.
Perfect. Thank you.
And I would just say that that's dead on what I was going to say. I mean, practice, when she said practice, 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 you've got to rehearse so that it becomes second nature when you walk in to that interview and you're across from somebody. You're not going to be nervous if you practiced. And again, the resources are right in front of you, right? The mock interviews that, Quincy helped set up, those things, do as many as you can. And the resume writing, resources that we have in the university, I mean, they're all here for you to take advantage of. So take advantage of them. I mean, it's amazing. You'll find it's amazing if you practice something, whether it's a presentation or an interview process, how much better you'll get just the second time. How many errors you find how many ums and stupid words that you use in answers the first time around, that as soon as you take that practice, you sand those out the next time, and they don't exist. You get geometrically better, as you practice more. So I would say just do that. Practice.
And practice isn't something that just new people do. Practice is something that smart people do. So I'm making a career change tomorrow, and I practiced with my older sister. She kicked my butt 3 different times to, say, you over explain things way too much, and so get someone who can think critically and give you those corrections.
That's so smart. Anybody on the call have any last minute questions or comments? Okay, well, thank you so much, Anna, Professor Carnuta. This has been extremely helpful and very practical. So I hope students on the call, please, review as like your to-do list almost, the things in the chat. Spend some time preparing. We just thank you both so much. This has been really great.
Been my pleasure.
All right.
Thank you.
All right, everyone get to class. I
See
said
you
that the
later.
last session too. Okay, bye.
Bye-bye.
Thank you.